According to breastcancernow.org, breast cancer affects 1 in 8 women and 1 in 830 men. With these statistics, one of your close friends will most likely contract breast cancer within their lifetime. Today, I'm going to be talking about breast cancer. My family has a long line of breast cancer within their history, and my mom just finished her last round of chemo treatment for breast cancer last week. So with this speech, you can learn the warning signs of breast cancer and perhaps help yourself or a family member or a friend. So first, I will be talking about the symptoms of breast cancer. According to breastcancernow.org, symptoms for breast cancer include new or changing lumps in the breast or underarm, change in the skin around the breast such as redness, puckering, rash, or inflammation in the skin, and also any change in the nipple such as discharge in one or both nipples, a rash around the nipple, or nipple puckering. So also according to breastcancernow.org, new lump in the breast are the most common signs of breast cancer and the most clear signs of breast cancer. So the way to check for this is the TLC method. TLC stands for touch, look, check. Touch is when you give yourself a breast exam and you touch your breast to find any new lumps or existing changing lumps. L stands for look, so you look at your breast and check for any new skin changes around the breast or nipple, such as inflammation or redness, like I said before. And finally, there's check. So if you see any of these changes, you check with your general practitioner to make sure everything is going okay. So next is the diagnosis of breast cancer. According to mayoclinic.org, tests and procedures are used to diagnose breast cancer. So first is a breast exam where a doctor will feel your breast and check for any lumps or in your breast or underarm. There's also mammograms where it's an x-ray of your breast, ultrasound of your breast, there are MRIs of your breast, and finally there are biopsies where the doctor will take out a piece of breast tissue and check for cancerous cells. So the next step in diagnosing breast cancer is staging. Staging is when you figure out to what extent someone has breast cancer and check so you know the prognosis of the breast cancer. The tests and procedures used to stage breast cancer, according to the Mayo Clinic, are blood tests, mammograms, MRIs, CAT scans, bone scans, or PET scans. But sometimes the best way to figure out what stage you're at or anyone is at is to do surgery and to go in and see what's going on in the breast and see how big the tumor is, if it's grown, and all that type of stuff to make sure they have the staging completely correct. So finally, I'm going to be talking about the treatment of breast cancer. According to the American Cancer Society, there are 2 different types of treatments for breast cancer. The first type of treatment is localized treatment. Localized treatment, as it sounds, is a treatment that affects only the place where the tumor is. One example of this is surgery. A surgery in breast cancer will go into your breast and take out the cancer of the breast, and because it only affects where the tumor is and only affects the tumor, it is a localized treatment. The other form of localized treatment is radiation. So radiation is where they send radiation waves into a person's body to make the cancer smaller and hopefully get rid of it. And with those waves, because they can be localized into certain parts of the body, and the waves are only going to be sent, in this case, into the breast, that is a localized treatment because it does not affect the rest of the body. The other form of treatment, according to the American Cancer Society, is systemic treatments. So as opposed to local treatments, systemic treatments can reach cancer cells anywhere in the body. So some can be given by mouth, injected into the muscle, or injected directly into the bloodstream. So different types of systemic treatments include the most common and commonly known is probably chemotherapy, but there is also hormone therapy, targeted drug therapy, and finally it's a newer type of systemic therapy is called immunotherapy. So now breast cancer can be understood by the symptoms, diagnosis, and treatments. Now when you see someone supporting a pink ribbon, you can appreciate it means so much more than a cute pink accessory. Thank you.